Shortness of breath, a symptom you should never ignore. Shortness of breath, medically known as dyspnea, is a symptom that can be both alarming and indicative of a variety of underlying health issues. It is a sensation of not being able to get enough air or a feeling of tightness in the chest. While it can be caused by something as benign as vigorous exercise, it can also be a sign of serious medical conditions. This comprehensive guide will address all the pressing questions you might have about shortness of breath, its causes, and when to seek medical attention. What is shortness of breath? Shortness of breath is a subjective experience where an individual feels that they cannot breathe deeply or efficiently. It can be acute, sudden and severe, or chronic, long-lasting. The sensation can range from mild discomfort to severe distress, making it difficult to engage in daily activities. Common causes of shortness of breath. Shortness of breath can be caused by a wide range of conditions, some of which are more serious than others. Here are some common causes. Respiratory conditions. 1. Asthma, a chronic condition where the airways become inflamed and narrow, leading to difficulty breathing. 2. Chronic obstructive pulmonary disease, COPD, a group of lung diseases, including chronic bronchitis and emphysema, that cause airflow blockage and breathing-related problems. 3. Pneumonia, an infection that inflames the air sacs in one or both lungs, which may fill with fluid. 4. Pulmonary embolism, a blockage in one of the pulmonary arteries in the lungs, usually caused by blood clots that travel to the lungs from the legs. 5. Lung cancer. Tumors in the lungs can obstruct airways and cause shortness of breath. Cardiovascular conditions. 1. Heart failure, a condition where the heart cannot pump enough blood to meet the body's needs, leading to fluid buildup in the lungs and shortness of breath. 2. Coronary artery disease. Narrowing or blockage of the coronary arteries can reduce blood flow to the heart muscle, causing chest pain and shortness of breath. 3. Arrhythmias. Abnormal heart rhythms can affect the heart's ability to pump blood effectively, leading to shortness of breath. Other causes. 1. Anemia, a condition where the body does not have enough red blood cells to carry adequate oxygen to tissues, causing fatigue and shortness of breath. 2. Obesity. Excess weight can put pressure on the lungs and diaphragm, making it harder to breathe. 3. Anxiety and panic attacks. Psychological conditions can cause hyperventilation and a sensation of shortness of breath. When to seek medical attention. Shortness of breath can be a sign of a life-threatening condition, and it is crucial to know when to seek immediate medical attention. You should call emergency services or go to the nearest emergency room if you experience shortness of breath along with any of the following symptoms. 1. Chest pain or pressure. 2. Fainting or loss of consciousness. 3. Severe difficulty breathing or gasping for air. 4. Rapid or irregular heartbeat. 5. Swelling in the ankles or feet. 6. High fever, chills, or cough with blood. For chronic or less severe shortness of breath, schedule an appointment with your healthcare provider to discuss your symptoms and undergo appropriate testing. Diagnostic tests for shortness of breath. To determine the cause of shortness of breath, your healthcare provider may recommend several diagnostic tests, including 1. Physical examination, listening to your lungs and heart, checking for signs of fluid retention, and assessing your overall health. 2. Chest X-ray or CT scan, imaging tests to look for abnormalities in the lungs and heart. 3. Pulmonary function tests, tests that measure how well your lungs are working. 4. Electrocardiogram, ECG, a test that records the electrical activity of the heart to detect heart problems. 5. Blood tests, to check for anemia, infections, and other conditions that might cause shortness of breath. 6. Echocardiogram, an ultrasound of the heart to evaluate its structure and function. Treatment options for shortness of breath. The treatment for shortness of breath depends on the underlying cause. Here are some common treatments based on different conditions. Respiratory conditions. 1. Asthma, inhalers, bronchodilators, and corticosteroids to reduce inflammation and open airways. 2. COPD, medications, oxygen therapy, and pulmonary rehabilitation to improve lung function. 3. Pneumonia, antibiotics for bacterial infections, rest, and fluids. 4. Pulmonary embolism, blood thinners to prevent further clots and, in severe cases, clot removal procedures. 5. Lung cancer, surgery, chemotherapy, radiation therapy, or targeted therapy based on the type and stage of cancer. Cardiovascular conditions. 1. Heart failure. Medications to reduce fluid buildup, improve heart function, and lifestyle changes. 2. Coronary artery disease. Medications, lifestyle changes, and procedures like angioplasty or bypass surgery. 3. Arrhythmias. Medications, lifestyle changes, and procedures like cardioversion or ablation. Other treatments. 1. Anemia. Iron supplements, dietary changes, or treatments for underlying conditions causing anemia. 2. Obesity. Weight loss through diet, exercise, and potentially bariatric surgery. 3. Anxiety and panic attacks. Counseling, medications, and relaxation techniques to manage symptoms. Lifestyle changes to improve breathing. In addition to medical treatments, certain lifestyle changes can help improve breathing and reduce shortness of breath. 1. Quit smoking. Smoking damages the lungs and can exacerbate respiratory conditions. 2. Exercise regularly. Regular physical activity can strengthen the respiratory muscles and improve overall fitness. 3. Maintain a healthy weight. Losing excess weight can reduce the strain on your lungs and heart. 4. Stay hydrated. Drinking plenty of water helps keep the mucus in your lungs thin and easier to expel. 5. Avoid allergens and pollutants. Limit exposure to substances that can trigger respiratory symptoms, such as dust, pollen, and chemical fumes. Breathing techniques to alleviate shortness of breath. Certain breathing techniques can help manage shortness of breath and improve lung function. 1. Pursed lip breathing. Inhale slowly through your nose, then exhale through pursed lips, as if blowing out a candle. 1. This technique helps keep airways open longer and reduces the work of breathing. 2. Diaphragmatic breathing, also known as belly breathing. This technique involves breathing deeply into the diaphragm rather than shallowly into the chest. Place one hand on your abdomen and the other on your chest. Inhale deeply through your nose, allowing your abdomen to rise, then exhale slowly through your mouth. 3. Controlled coughing. Helps clear mucus from the lungs. Take a deep breath, hold it for a few seconds, then cough firmly. Psychological impact of shortness of breath. Experiencing shortness of breath can be distressing and may lead to anxiety or panic attacks. It's important to address the psychological impact and seek support if needed. 1. Counseling. Talking to a mental health professional can help manage anxiety related to breathing difficulties. 2. Support groups. Joining a support group for individuals with similar conditions can provide emotional support and practical advice. 3. Relaxation techniques. Practices such as meditation, yoga, and progressive muscle relaxation can help reduce stress and improve breathing. Preventing shortness of breath. While not all causes of shortness of breath can be prevented, certain measures can reduce the risk. 1. Regular checkups. Regular visits to your healthcare provider can help detect and manage underlying conditions early. 2. Vaccinations. Stay up to date with vaccinations, such as the flu and pneumonia vaccines, to prevent respiratory infections. 3. Healthy lifestyle. Maintain a balanced diet, exercise regularly, and avoid smoking and excessive alcohol consumption. When shortness of breath is an emergency. Recognizing when shortness of breath is an emergency can be life-saving. Seek immediate medical attention if you experience 1. Sudden and severe shortness of breath. 2. Chest pain or pressure. 3. Fainting or dizziness. 4. Rapid or irregular heartbeat. 5. Blue or gray lips or fingertips. 6. High fever with chills and cough. Shortness of breath is a symptom that should never be ignored, as it can indicate a range of underlying health issues, some of which are serious and require immediate medical attention. Understanding the potential causes, recognizing when to seek help, and knowing the available treatments can empower you to take control of your health. By incorporating lifestyle changes, practicing breathing techniques, and staying informed about your condition, you can manage shortness of breath and improve your quality of life. Always consult with your healthcare provider for personalized advice and treatment options. Remember, your health is your most valuable asset, and taking proactive steps to address symptoms like shortness of breath can lead to better outcomes and a healthier, more fulfilling life. Like and subscribe.